Hi guys. So I got chapter 54, which are drugs that affect the upper respiratory tract. And to start, I got my mnemonics, which is Adam, A-D-A-M-E, like Adam and Eve, E at the end of Adam. So A is for antitussive, D is for decongestant, the second A is for antihistamine, the M is for mucolytics, and the E is for expectorant. So I will start this type of drug work to keep the airway open and to improve gas exchange and for the movement of gas along the respiratory tract. I will start with the first A, which are antitussive. So they work with infections, patient with infections, and they work by suppressing who has another different type of disease that causes cough, and they work by suppressing the cough reflex. Some examples of this class are codeine, hydrocodone, codeine and hydrocodone. They work by suppressing the cough reflex, which is in the brain, in the medulla center of the brain. And they are rapidly absorbed in the liver and excreted in the urine. And women who are pregnant or are lactating are not supposed to take this type of drugs. Some of the side effects are dryness of the mucous membrane and increased respiratory tract secretion. Since it's a CNS depressant, we need to look for signs of drowsiness, sedation. It can cause vomiting, diarrhea, nausea, and we need to assess for the temperature to make sure to check the infection and to see if the drug is working, especially sound to listen to the lungs. The second are the decongestion, and this type of drug are divided into three types. We have oral decongestion, we have topical nasal decongestion, and topical steroid decongestion. They work by decreasing the production of secretion and by causing local vasoconstriction of a upper tract. It also promotes drainage and improves airway. Some of the side effects are burning, irrigation, dryness of a mucosa, and headache. The third type of class that I'm going to talk about are the antihistamine. This type of class work by blocking the release of histamine, it's a chemical that's released when there's an inflammation. It works by increasing secretion and narrowing the airway. By blocking the release of antihistamine, we are decreasing secretion and then opening the airway. This type of drug are divided into two kinds, the first generation and the second generation. The first generation are sedative, so when the patient is taking it, we need to make sure that they are not driving, and it could cause drowsiness. It's a CNS depressant. The second generation are not sedative. It's important to assess for orientation when it's the first type of first generation that the patient is taking, and reflexes. We need to also look for liver and renal function. The third, I will talk the last. The fourth is the expectorant, and it only have one drug in this type, which is guaifenesin. It increases productive cough to clear the airways and by liquefying the lower respiratory tract secretion and reducing the viscosity of the secretion and allow easier movement of mucus secretion. So it works by making the thick secretion more liquid so it can flow better, and it's also a CNS depressant, so we have to assess for reflex drowsiness and sedation, and also assess for skin and lesion. And the last type is the mucolytics. The mucolytics are for patients who has a high risk for some diseases such as COPD, pneumonia, tuberculosis, which are infection, and which cause thick secretion of the mucus. They work by liquefying the mucus again, like the expectorant, and they are administered by nebulizer or by straight into the airway by ectotracheal tube or tracheostomy. They work by liquefying the respiratory secretion for high risk patient, coughing up thick secretion. Some adverse effects involve the GI tract, upset stomach, and stomatitis, bronchospasm, and more rashes. It's important for this type of drug to monitor for BP, skin, the pulse, to monitor for blood pressure, skin for lesion, and pulse. For all of these type of drugs, when we give it to the patient, we need to make sure that we monitor we listen to their lungs to make sure that they are breathing better, and then to make sure that they don't have any allergies to the chemicals in the drug. That's it. Thank you.